Good day, our report is all about cystotomy. Cystotomy is a surgical incision or opening into the urinary bladder. Signalment: patient's name Garita, species Felis catus, age 2-year-old, sex female, weight 2 kilograms, color markings white and black. For the indications: removal of cystic and urethral calculi, identification and biopsy of masses, repair of ectopic ureters, and evaluation of urinary tract infection resistant to treatment. For the anatomy, the urinary bladder location varies depending on the amount of urine it currently contains. So, pag empty siya, it lies primarily sa pelvic cavity. The bladder is divided into the trigone, which connects it to the urethra and the body. Sa blood supply naman ng bladder, receives its blood supply from the cranial and caudal vesicles, arteries, which are branches of the umbilical and urogenital arteries, respectively. Sa preoperative preparation, fasting for 8 to 12 hours, screen preparation, patient preparation, surgical positioning, dorsal recumbency, IV fluid or hydration. We use D5-LRS, anesthesia, pre-anes, atropine sulfate, and Zolidil. Patient monitoring. Operative technique: first, palpate the urinary bladder 3 fingers below the umbilicus, incise the skin and muscle with blade number 10. After incising the skin and muscles, identify and isolate the bladder from the rest of the abdominal cavity by placing moistened laparotomy pads beneath it para hindi makontaminate yung ibang internal organs. Place stay sutures in the bladder apex and trigone to facilitate manipulation. So, after placing stay sutures, make a longitudinal incision in the ventral or dorsal aspect of the bladder, away from the ureters and urethra, and between major blood vessels. Remove urine by suction or perform intraoperative cystocentesis before cystotomy. Incise a small section of the bladder wall adjacent to the incision to submit for aerobic culture. Check the bladder apex for a diverticulum and excise it if necessary. Close the bladder in a single layer using a continuous suture pattern with absorbable suture material. For a 2-layer closure naman, suture the seromuscular layers with 2 continuous inverting suture lines. So, yung ginamit namin, Cushing and then Lambert. Yan. Incise the skin. We use groove director to avoid puncturing the internal organs. Yan, after we identify the urinary bladder, isolate the urinary bladder to moisten laparotomy sheets or pads. Cystocentesis. Yan, placing stay suture on the urinary bladder. Incising the urinary bladder. So, sa post-operative technique naman, after the surgery, hindi pa tinanggal yung D5-LRS to provide support until it recovers for 24 hours. Tapos, sulfonamic acid as an analgesic. Sa antibiotic naman, cephalexin 1 ml per day. Complication: urine leakage, recurrent bladder stones, hemorrhage, dehiscence, infection of the surgical site. Tapos ito yung sa fluid and drugs computation. Atropine sulfate, 0.14 ml. Sa zolidil, 0.4 ml. Sa IV fluids for maintenance, 130 ml per day, 60 ml. Sa total fluid, 100 ml. Drip rate, 7.92 ml per hour. Drops per minute, 31.67 GTTS per minute. Drops per sec, 0. Drops per sec. For the drugs combination, for intraoperative medication, tranexamic acid, 3.3 ml. Post-operative medication, ampicillin, 2 kg ay 0.22 ml. Tolfenamic acid, 0.2 ml.